the Transcendent is recruiting 5,500 participants over 5 years to participate in several sub-research programs. Could you share if the recruitment channel for study participants is only through the 360 Concussion Care clinic clients, or could our registrants help you achieve those participant targets?
And that's a great question. And I love a big tent and I love to collaborate. So I think there's lots of opportunities for partnership with the Athletic Therapist Ontario group and even beyond too. So again, a little bit of context. The 360 Concussion Care clinics were founded to address the diverse needs of all Ontarians with concussion across the full spectrum, young to old, all mechanism injury. So of course, sport, which is still the most common in kids, but people have motor vehicle collisions and assaults and workplace injuries and falls on the ice. Unfortunately, some clinics in some situations have certain criteria. You have to, I'm sure even some athletes, they play their collision sport or high risk sport, but then they were in a motor vehicle collision and now they're kind of in that netherworld in which they're not sport, but they're not this either. And how do you manage those things? So the whole point is our goal is to get people back to doing all those things they want and need and love to do. Having an interdisciplinary clinic is really helpful for those things. One of the hats I wear, just to give a bit of background, I'm a pediatric emergency physician by training, but I also, as you know, am very involved in concussion research and guidelines. I've been leading the living guidelines for concussion for 15 years now. And so the living guidelines takes all the evidence and compiles that into recommendations based again on 30, 40 international experts. And so one of the things that recent updates to the guidelines have been is anyone who's at high risk of having persisting symptoms, or any athlete who wants to get back to higher risk sports or get clearance for sport should be seen by an interdisciplinary concussion clinic. And so 360 is one of those clinics. There's lots of clinics as well that do similar things, but again, it should be interdisciplinary. And what's unique in Ontario is the Rowan's Law. And I know, I am very involved with that as well. I was actually on the Inquest expert panel as an expert to talk about why this is so important. And so I'm a big believer in all those advances that were done in light of that unfortunate tragedy. And so while Rowan's Law as a pediatrician is so important, it makes sure that our kids do need clearance from a physician or nurse practitioner before getting back to that, to get back to clearance. And so one of the things is, this is a great way to collaborate. So because of the way the data structure is, and I have particular questions I have to ask, and because of the Rowans, the way the Transcendent patients are currently being recruited are through the network of the clinics. But I think there's lots of opportunities for athletic therapists to collaborate and to facilitate that recruitment. So first, if a patient is having a suspected concussion, well, first of all, they're going to need to see a physician to confirm to move through the Rowan's Law anyway, and also to be cleared. And that's just Rowan's Law, and that's something that we can help with. So at the clinic and part of Transcendent, anyone who comes can be recruited into the study. And there are ways in which anyone who is a sport injury that's acute, when we define that as within the 2 weeks of injury, can actually self-refer to any of the clinics. So those athletes under 18 who have an acute sport injury can just go to the portal on the 360 website and click that self-refer. Now, if that same athlete had been in a motor vehicle collision or it was an assault or they were over 18, there are other ways we try to make it as easy as possible for those patients to be referred. There's a portal on the website. Those are ways in which we can get the patients enrolled into Transcendent, and having the athletic therapists, again, that helps your patients get back to doing the things they love, because then they can get the Buffalo bike test, they can get the clearance by the doctor, and then be cleared to get back to the sideline, the rink, the field, the pitch, wherever they want to be. But I also think it'd be really, important to think about those other people that are stuck. They can easily just have the athletic therapist say, hey, just ask your doctor for a referral to interdisciplinary care, because they're going to need that anyway. And as an emergency doctor, I know a lot of people don't have family doctors, but walk-in clinics, urgent cares are probably more than happy to just be aware that there's easy ways to get that. The best, though, that being said, those are people with concussions. I kind of inferred in my first answer. I think the best way to treat a concussion is to not let it happen. And I think an exciting way in which we can partner and think about ways of collaboration and use your expertise as well, and perhaps even think about novel ways of doing that is through the prevention. And so we are currently piloting things like advanced physiology assessments to look at eye tracking, neck strength, neck range of motion using like not just regular measurements, but actually digital measurements that measure Newton force meters, like really novel equipment to look at these assessments of what is your function before you got hurt. And so we're already exploring some partnerships with Rugby Ontario, the RCMP, the Canadian military, to see not just are these helpful after they got hurt, but to see what are the things that we can do to assess to get people to their versions where they're not going to get hurt as well. And I think that's a really novel way where the athletics therapist as part of your network can maybe connect them to our research program to look at potential cutting edge assessments. And so the thought is if individual athletes are interested, they can also go to the 360 website and there's a whole thing on the prevention program and any individual can just do it themselves. I also think it may be novel to look at teams and say, could he make an interesting study and say, hey, here's some teams that do and teams that don't, or things like that. And or if an athletic therapist is really interested in this and wants their whole team assessed, they can also go on that prevention tab and request some more information and see what we can do to work well with any of the teams or groups that are interested in that prevention program.